Hello, I am excited to share with you our group presentation on Ebola. My name is Kyle Stoltz, and I will be covering what Ebola is, who it affects, and risk factors that are associated with it. Also presenting with me today will be Jessica Kirby and Rachel Hunter. Jessica will be presenting information on the cultural, economic, and environmental factors that contribute to the spread of Ebola, including the health, economic, and social consequences of these factors, as well as current initiatives in place to combat Ebola. Lastly, Rachel will be speaking on the current flaws in initiatives, the overall gaps in these initiatives, as well as go over some recommendations to address these gaps. First, let's start off with what Ebola is and why we should be concerned about it. Ebola is a virus that was first discovered in 1976 near the Ebola River in what is known today as the Democratic Republic of Congo. It is a virus that is native to Africa and is highly contagious. Ebola typically lives in host animals, which then transmit the virus to humans via direct contact or through ingestion of an infected animal. Ebola causes hemorrhagic fever, organ failure, and ends in death for up to 90% of people infected. There are 6 different strains of Ebola, 4 of which are known to cause disease in humans. According to the World Health Organization, the overall risk is considered high at the national level due to the nature of the disease and the lack of epidemiological and demographic information that is currently available due to the remoteness of areas prone to outbreak. Who was affected by Ebola? Since Ebola is a non-discriminant virus, it infects all individuals who come into contact with the virus. Some of the individuals that are most at risk include healthcare workers, family members, or others who are in close contact with infected peoples, and mourners during burial rituals. Burial mourners are at risk since these traditions routinely involve mourners coming into contact with the deceased. Out of respect for traditional burials, a slight modification of the ceremony is recommended to limit exposure for mourners. Modifications are asked due to the fact that the Ebola virus has been proven to be viable for up to 7 days after the death of the host. Maintaining strict infection control prevention measures are still relevant and absolutely necessary at these ceremonies to ensure the virus does not spread. Although hosts for Ebola are animals such as bats or primates, a vast majority of reported cases are from human-to-human transmission via bodily fluids such as saliva, blood, feces, or even semen, which can enter the body through broken skin or mucous membranes. Indirect transmission can occur via contact with environmental contaminants, exposure to contaminated objects such as dirty needles, and burial ceremonies where mourners regularly come into contact with the deceased. Infection can also occur from contact with soiled linen handled by a healthy person, emphasizing the highly contagious nature of Ebola, which makes quarantining the main priority to limit outbreaks. For example, on May 8, 2018, 17 out of a reported 21 cases were linked to contact with an infected individual. There is also no evidence that Ebola can be spread via insect bites. While the typical onset of symptoms is between 8 to 10 days, it is possible to experience these symptoms as early as 2 days or even up to 21 days after exposure. Luckily, people who are infected are only contagious once symptoms begin to manifest. Some of these signs and symptoms that may be experienced are headache, fever, loss of appetite, general weakness, joint and muscle aches, and stomach pain. Some of the more serious signs and symptoms that may be experienced include diarrhea and vomiting, both of which may include blood, sore throat, rash, chest pain, bloody eyes, difficulty breathing and or swallowing, organ failure, and internal and external bleeding. Treatment options. Currently, there is no approved vaccine that is available for the clinical treatment of Ebola, although there are several that are being tested. Treatment is limited to supportive care for patients, which include IV fluid therapy, treatment of symptoms present with medication, and oxygen for those who are experiencing difficulties breathing or maintaining a proper oxygen saturation. Some other treatments that are available but which require much more sophisticated equipment are kidney dialysis, blood transfusions, and plasma replacement therapy. While there may not be a currently approved vaccination, in 2015, the World Health Organization funded and organized a trial in Guinea involving 4,000 people testing the Ebola CA Sufit vaccine. This vaccine has shown to have a 100% efficacy during this trial, and the results have been published. This vaccine is now being developed in sufficient quantities aimed at protecting frontline workers until enough can be created to make a difference in the fight against Ebola. What are the risk factors? Some of the risk factors associated with Ebola are travel to Africa, specifically regions that have had reported cases of Ebola, contact with infected persons and or body fluids, providing medical and or personal care to infected persons, handling infected animals, and the viability of Ebola even after the host organism has deceased. Donning of proper personal protective equipment is absolutely necessary when dealing with the Ebola virus in order to decrease the rate at which the virus is transmitted. Prevention. Since Ebola can easily and rapidly spread through individuals, this means the importance of wearing proper protective equipment in a healthcare setting even more crucial. By strictly adhering to specific infection control prevention and control measures, you can significantly decrease the risk of becoming infected with the Ebola virus. Infection control measures include wearing appropriate PPE such as gloves, gown, and face mask, hand washing, avoiding contact with infected bodily fluids, whether it is confirmed or suspected that the individual has been infected, and refrain from handling or preparing bodies of persons who are suspected of or confirmed to have died from the Ebola virus. Other things that can be accomplished to mitigate the spread would be to ensure equipment that has been used is properly sterilized and isolation of patients who are either suspected or confirmed to have contracted Ebola. Both the World Health Organization and the Center for Disease Control and Prevention have developed a set of guidelines to help prevent the spread of Ebola. This guideline is called Infection Control for Viral Hemorrhagic Fevers in the African Healthcare Setting.
Hi, my name is Jessica Kirby. The World Health Organization states that as of March 5th of this year, there have been 807 confirmed cases of the Ebola virus and 65 probable cases. The total deaths equals 548, with 483 being confirmed and 65 probable. Since the last report, that was done February 26, 2019, there were 25 new cases and 15 new deaths. There are many factors that contribute to the Ebola crisis in Africa. The main factor is their weak health system. While there are public and private health systems in Africa, the private sector is only used by the wealthiest 20% of the population. Africa has some of the poorest countries in the world. 75% of the world's poorest countries are located in Africa. Conditions such as population growth, war, poverty, and poor health infrastructure have contributed to the spread of Ebola. Poverty is a large economic factor that goes along with living conditions that are poor. 37% of the 738 million people globally that lack access to clean water live in sub-Saharan Africa. Annually, sub-Saharan Africa misses out on 30 billion as productivity due to their lack of water and problems with sanitation. Poverty is linked with little education. Less than 20% of African women have access to an education. The low economy also leads to a lack of healthcare providers in the area. The ratio for patient to providers is extremely low in Africa, with most countries having a ratio of 1 to 2 providers per 1,000 patients. Another factor that contributes to the shortage of healthcare providers is the doctors and nurses being infected with the disease themselves. This makes it hard to get new providers and nurses into the area when they have to consider the risk of infection along with the possibility of death due to the poor facilities and lack of supplies. Environmental factors include country size, road conditions, lack of road and transportation systems, and population mobility. The road conditions in rural areas are poor or non-existent, making transportation and telecommunications weak in these areas. Along with their poor road conditions, there's also a lack of road and transportation systems. This causes issues with diagnosis and treatment of the disease. With the lack of road systems and transportation, laboratory specimens can't get to their appropriate laboratories in time. Patients cannot be transported to treatment centers for the care and supplies, and also supplies are hard to get into these areas. Despite the poor road conditions, population mobility is another environmental factor that contributes to this problem. This is making it very difficult to contain the disease and keep it from spreading between the borders. When one community or city is finally free of the disease, people from neighboring countries will come to that country to seek treatment, which will introduce new cases into the area. The major cultural belief that is fueling the outbreaks of the Ebola virus in Africa are their funeral and burial rituals. These are practices such as mourners bathing in or rinsing themselves in the water of the corpses, as well as mourners sleeping near the corpse the night of their death in order to transfer their powers. The compassion that these communities have for their members is another contributing factor. They show compassion for the ill throughout treatment, as well as during the ceremonial care for their bodies if they shall pass. They will help each other and help their sick family members regardless of the risks of catching the disease themselves. Touching is a cultural belief that shows support for the sick, which also contributes to the spread of the disease. Those caring for the ill while they are sick or during their burial rituals will more than likely become infected with the disease themselves. Although Africa has had traditional medicine long into their history, With the lack of government-run health facilities and their poor economy, the use of traditional healers and self-medication is a large contributing factor. 70 to 80% of the population uses traditional medicine, while the rest use self-medication or traditional healers. There is also a lack of trust with the community and the control efforts, along with a fear and the misperceptions of the disease. With the rise in the outbreak and the rise in the cases of Ebola, it was believed that the hospitals and clinics were the places that people were getting sick and was the cause of their deaths and the cause of the rise in those infected with Ebola. The community turned to natural healers more in order to avoid going to these health facilities. However, this was not the case. It was actually found that many of the outpourings of the cases were linked to the herbalist and traditional healers, and not with the healthcare facilities run by the government. There are significant socioeconomic consequences of Ebola in Africa. There is a decrease in the income for the households, with the decline in family members either due to the illness, death, or caring for those that are ill with the disease. Agriculture is also affected, with there being a loss in production of goods due to closing of the markets, fewer middlemen selling the goods, as well as less transportation of the goods. There's also a shortage with the food. Livestock is depleting because families are having to eat their livestock in order to get food. Not to mention the financial burden. If looking specifically at the 2014 to 2016 West Africa outbreak, this was the largest of its kind. It is estimated that the outbreak alone cost approximately $53.19 billion and resulted in 11,162 deaths. There were communities in which the outbreaks occurred. They were either severely depleted or were completely wiped out due to the deaths or people leaving the community out of fear. There was also a decrease in the cross-border trading due to restrictions on goods and services. The health consequences are huge. Not only were people within the community affected, but many healthcare workers died. This, along with the lack of supplies, caused healthcare facilities to shut down completely. There was already a shortage in providers and clinics in the area. This just further depleted the healthcare system. This causes setbacks not only in the Ebola crisis, but also in the control and treatment of other diseases such as tuberculosis, malaria, and HIV and AIDS. There are initiatives to help to prevent the Ebola virus from creating a large epidemic or outbreak like West Africa saw in 2014. A few of the major ones are the Africa Center of Disease Control and Prevention. This was launched in January of 2017 with aims to help with prevention, detection, and response. Their objectives include to establish a surveillance system, to engage in preparedness and response activities, to bring member states up to compliance with the IHR, to conduct risk assessments, and to establish laboratory networks. The future of this initiative will depend on its funding. The Coalition of Epidemic Preparedness Innovations is another initiative. This was started in January of 2017 as well. Their aim is also for prevention and response. Their charitable partnerships with public and private sectors is to speed up the development of vaccines for diseases. They are still short on their funding goals, but they have launched 2 calls for proposals for the development of new vaccines. The European Medical Corps was launched in February of 2016 by the European Union. Their goal is the quick deployment of technology and human resources for disaster preparedness, response, and recovery. This includes 8 medical teams, 2 mobile biosafety laboratories, 3 medical evacuation teams, and 5 logistics/coordination experts. The World Health Organization started the WHO Health Emergencies Program, which aims in prevention, detection, and response, and this was started in January of 2016. Their focus is over 6 major areas of work. These include infectious hazardous management, WHO member state preparedness, risk assessment and health emergency information management, emergency operations, management and administration, and external relations. Here, you will find a table that lists the 9 high-level initiatives that were established following the 2014 Ebola crisis in West Africa. You will see some of the initiatives that were discussed on the previous slide. This table includes the name of the initiative, their sponsoring entities, their launch date, funding goal, percent funded, other progress, as well as their intervening phase.
Hi everyone, I'm Rachel. When researching the gaps in the current initiatives addressing Ebola in Africa, there are a few gaps that stood out. Overall, there is a large problem with workforce capacity. In order for operations to run smoothly, there needs to be the correct number of staff members in the workforce. Another gap in the current initiatives is the need for formal mechanisms for crisis funding. Other aspects that are problematic seem to be the delegation of authority, as well as the need for more community engagement. When looking directly at the organizations implementing these initiatives, I noticed that the World Health Organization is struggling in the staff recruitment and skills department. Having the correct recruitment tactics and understanding the skills each member of the team needs is very important. I also saw the World Health Organization having a hard time with delegation of authority and as well as lacking communication. As far as the World Health Organization contingency fund for emergencies, I saw the main gap of 67% funding of their target goal of $100 million in 2017. When looking at each individual initiative, we see notable gaps, and when we look at the crisis as a whole, we will still see gaps that no initiatives have addressed so far. The first notable gap is the lack of transparency. These initiatives that are currently set into place don't provide up-to-date financial information, which makes it concerning at the attempts to be transparent and getting backing from other operations. Another notable issue is the fact that no programs have yet to announce their plans to look at the detection phase of Ebola. The initiatives already put in place are working at the response phase, but not on focusing on the detection. Early detection is key to understanding the diagnosis and factors that play into the disease. There needs to be a program that addresses this issue. There are many recommendations that can be used to help the initiatives that are put into place prevent Ebola virus from creating a large epidemic. The first recommendation would be to create a new initiative focusing on the detection and diagnosis of Ebola instead of just working on the response phase. If you look at the source and early on detection abilities, the need for the response phase will lessen. When looking at the financial aspects of these initiatives, we can note that fundraising events may boost the donations. There are many ways to ask for donations, but fundraising events will not only spread the word of the organizations, but it will also be means to educate the public about the spread of Ebola. In order to combat the lack of authority to delegate the tasks, a proper authority ranking system can be put into place. If there are designated people in charge and in a more organized ranking system, there will be less confusion as to who needs to be delegating. In order to calculate the cost to hold a fundraiser event, we first look at the cost to treat one patient in Africa. According to the Public Health Emergency of International Concern, it costs between $480 to $912 to treat one patient with Ebola. I found the standard price of a fundraising event equals around 20 cents per dollar earned. If our goal for the fundraising event is to be able to treat at least 50 people, we would need to raise around $50,000, leaving our fundraiser event to cost roughly $10,000. Although recommendations may be pricey, it is important to find ways to create solutions to the flaws presented by the organizations involved.
In conclusion, we have covered what Ebola is, who it affects, risk factors associated with it, and some of the economic, cultural, environmental factors that contribute to the spread of Ebola, and the health, economic, and social consequences of these factors. We also covered current initiatives, flaws in these initiatives, including gaps, and also provided some recommendations to address these gaps. We hope that you have enjoyed our presentation. Thank you.